Hello and welcome to episode 4 of Conversations for the Common Good. I'm Raquel Webb, Manager of Spiritual Care at CHI St. Joseph in Bryan, Texas. And I'm joined today by Tyler Whipkey. Tyler, tell us a little bit about yourself.
Well, hello everyone. My name is Tyler Whipkey. I'm the Director of Mission and Spiritual Care at St. Luke's Hospital in the Woodlands. And more than happy to be with you today.
Great. Well, we've launched this series to respond to some of what we're assessing in ourselves and each of our team members on how do we cope during the craziness of life right now. And today's topic is spiritual health. So Tyler, we're going to be talking about spirituality. It sounds like just that term alone, spirituality, has many different definitions. So can you start us off by helping us understand what we mean when we say spirituality?
Sure. So you're exactly right. I can almost guarantee that if I were to hand everybody watching or listening today a piece of paper and say, I want you to write down your personal definition of spirituality, that some of the answers may be similar, but they wouldn't be the same. And spirituality often kind of gets mingled and interlocked with religion, and they're really not the same. And we'll talk a little bit about that in just a moment. But I've got a few different definitions of spirituality that I'd like to share with you all, and I'm going to bring up my PowerPoint presentation. And these are a few different definitions of spirituality that a few different people who are much smarter than I am came up with. So Christina Pochalski, she's really written a lot about the intersection of spirituality and health. She says that spirituality is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to self, to others, to nature, and to the significant or the sacred. Mario Bogard, he wrote, spirituality means any experience that is sought to bring the experiencer into contact with the divine. In other words, not just any experience that feels meaningful, but something that puts you into contact with the divine or your higher power. And then Ruth Beckman Murray and Judith Proctor-Zenter wrote that the spiritual dimension tries to be in harmony with the universe and strives for answers about the infinite, and comes into focus when the person faces emotional stress, physical illness, or death. So that's a really broad term. Whenever I think about spirituality, I think about what is the thing that is giving me meaning and purpose in life, and also helps me to connect with God or the divine or my higher power. What is it that gets me out of bed in the morning and also connects me to God or my higher power, as well as the world around me? So that's what I think of when I think of spirituality, Raquel.
So one of the things that you mentioned was how spirituality often gets confused with religion. So I want to come back to that. I can't help but wonder what makes spirituality and religion different, and what similarities might we see in them?
Sure, great question. And there's a handy dandy Venn diagram on the screen to help us unpack that. So as you can see, spirituality and religion, they are two separate things, but they do share some certain characteristics or aspects. So spirituality has to really deal with, these questions of where do I find meaning? How do I feel connected, not only to my higher power in that vertical relationship, but also to the world around me and my community? And how should I live? Whereas religion, whenever we talk about religion, we're talking about different faith traditions like Christianity, Islam, Buddhism, Hinduism, those types of things. Religion seeks to answer what practices or rites or rituals should I follow? What is right and wrong? And what is true and false? Those are the things that religion help us answer. And then if you look in that middle area where these two circles intersect, we have belief, comfort, ethics, reflection, and awe. Those are the areas where spirituality and religion, they come together to really, really intersect well in those places. So I'm going to stop sharing my screen for just a moment so that I can see you, Raquel. What I would like to talk about what happens when people are spiritually unhealthy, because I know that as healthcare providers, this may be the first time that you've thought about spiritual health or spiritual well-being. And so let's talk a little bit about what that means. So when somebody is spiritually unhealthy and they're not paying attention to their spiritual health and their spiritual welfare and their well-being, often people have poor coping mechanisms. So whenever life gives them lemons, they don't have the right lemon squeezer to make lemonade. People often express feelings of isolation or loneliness because they're typically not connected to a community of faith, and they don't have a connection with their higher power, whatever that may be. Again, as we're talking about spirituality, I'm not just talking about like Christianity. I'm expanding the conversation much more broadly so that everyone can join in, because I firmly believe that there is a place for everyone to experience some sort of spirituality or take elements of a spiritual practice and apply them to their own lives. These feelings, whenever you're not spiritually healthy and you can't cope well and you're feeling lonely and isolated, they can express themselves physically. I can remember I had a patient in a former hospital setting, and we started noticing that she would come into the ER over the weekend. She'd show up on Friday night or a Saturday morning, and we would hold her for observation, and then she'd go home. And what was happening was she knew that if she came in over the weekend, that they couldn't work to get her discharged very quickly because we had reduced staff. And what was really happening was she was unhappy and she was lonely. And she knew that if she came to the hospital, that she'd be around people. And so whether she was just completely fabricating the symptoms or they were actually physically coming on her at that time, I couldn't tell you. But that was what we learned, was she was coming into the hospital because she wasn't doing well spiritually and she needed that human interaction and that connection. And that's why she wound up coming in. And that also goes with a lack of support. Again, if you don't have a solid relationship with those around you, which spirituality is part of a connection to the community around you, and you don't have a solid sense of support from a higher power or a faith tradition, you're going to find a lack of support. So let's flip the conversation, look at the other side of that coin and talk about what it means and the benefits of being a spiritually healthy person. So spiritually healthy people, they tend to be happier because they tend to, when life does give them lemons, they've got that lemon squeezer and they can make lemonade, and they've got the sugar that they need, that where they're not just drinking raw lemon juice. So spiritually healthy people tend to be happier people. They tend to be more well-connected, better connected with those around them, as well as their higher power, whatever that may be. And spiritually healthy people, they tend to have more meaning and purpose in their life. They know why they're here. They know what they're doing. They know what direction they're going in, which is important, especially as we think about the next 2 points that I'm going to bring up. And as you think about your patients, if you're in a caregiving role, as you think about your patients, their spiritual health is really going to have an impact on their physical health as well. Because let's say that you've got a patient who doesn't have a lot of meaning and purpose in life and really isn't doing well spiritually. When you prescribe them or you give them the prescription as part of the discharge instructions and they take that home, they may not be compliant with those meds. If they don't think that they have a reason or meaning or purpose, then they may not be compliant. And then what's going to happen? They're going to be right back here with us in the healthcare setting because they weren't compliant at home. There have been studies that have shown that like cardiac rehab patients and other patients who suffer from things like high cholesterol and high blood pressure, whenever their spiritual needs are met, that they have better outcomes. Their indicators are better and they're just healthier all the way around. And so our spiritual health really does have impacts on our physical health and our mental health as well. And that's where your chaplains really come in. I know that a lot of times folks think that the chaplains are just around to pray for people, and whenever people are upset, that we come in and we offer nice words, but we are really trained, we are clinically trained professionals to make sure that we're addressing patients' spiritual care needs. And so we're here to help you. We're here to partner with you as a member of the care team because we want everybody to be as healthy and as whole as they possibly can be.
Wow. So, Tyler, what if I'm listening in and as you were talking about unhealthy spirituality, what if I've noticed myself falling there, lack of support, feeling lonely, isolated? Can you maybe give us some steps of how we can become more spiritually healthy?
Sure, you bet. I'm going to share my screen one more time. There we go. Whoop. There's the right slide. So obviously this is not an exhaustive list, but these are a few things that I found that helped me and have helped some of my patients in the past to become more spiritually healthy people. So the first is connect with your higher power. Whatever your higher power is, you know the best way to connect and work in unison with your higher power. If you struggle with that, then my recommendation would be to find a chaplain in your hospital, your facility, or go to your faith leader and just talk to them because they would be somebody in your tradition who knows best. Connect with those around you. Isolation is a killer. And whenever you connect with people around you, you connect with other people who are like-minded and really fill you with that positive energy to be able to connect spiritually with yourself and with others. And then practice spiritual disciplines. Now, I know when I say the word spiritual disciplines, some of you may be thinking of like a monk in a monastery copying manuscripts. That's not what I'm talking about. Although if that helps you connect to the divine, then more power to you. But what I'm talking about are things like prayer. And they don't have to be long prayers. Some people think that if you pray and you're going to be a good prayer, that you have to do it for these hours on end. But I would just say start with 5 minutes, just 5 minutes of prayer. And that's all you really need to focus on. Solitude and retreat. I enjoy going on walks and hikes. And sometimes when I'm really pressed, I will just turn the radio off in the car and I'll drive in silence for a little bit. And that gives me time to spend not only with my own thoughts, but also connect with my higher power. Keep a gratitude journal. Raquel, I think we've talked about gratitude journals in the past in previous episodes. Those are fantastic things, as well as just regular journals to keep. Read your sacred text. Whatever text is sacred and holy to you and your tradition, spend some time in that each day. And then become a part of a faith community. I know that right now with COVID, that there are a lot of worshiping communities that have taken their services and interactions all online, and it's kind of hit and miss, and that can make it difficult. But I encourage you to really find a faith community that resonates with you and resonates with your soul, because that's the point of gathering with like-minded individuals, that you come away with some sort of edification or some sort of enhancement or being spiritually fed so that you can really do that well. I'm going to go ahead and stop my screen. And Raquel, I know I've talked a lot this episode, haven't really given you much of a chance to join in. I'm wondering, do you in your own life, have you found any spiritual practices or disciplines, or what do you do to stay spiritually healthy and whole?
So I think for me as a chaplain, a minister, a person of deep faith, spirituality is very important to me. And that top aspect of what you mentioned there, connecting to my holy, is very important every day. It's not always possible in my busy life to sit down and have a long time of reading scripture and praying and this in-depth, moment. So a lot of times I take what I can. Sometimes that's connecting to God for me through music, listening to soft music and looking out of my window and seeing nature. I connect spiritually that way with God, and that helps me. Another thing that I tend to practice a lot, that I've used a lot more now during COVID as life is crazy, is I practice a simple prayer. And I happen to be a Christ follower. And so we pray the Christ prayer, and we do this as we breathe. And so as I inhale and take in breath, I say, Lord Jesus Christ. And then as I exhale, I say, have mercy on me. And I can just say that for a few breaths. And I invite you to insert other words that might be meaningful to you and your spirituality. And as you breathe in, say a prayer words. And as you breathe out, say other words that might be meaningful to you and help you connect to your holy. And that in itself is just moments where you're concentrating on making a connection to something that brings you meaning. I'll share another one with you, because in my life and in my spirituality, my connectivity to my family is really important. And so, like with my parents and my sister, we're all very close. And I find that when I talk to them, it feeds my soul, my spirit. It really is a part of my spirituality because they bring me meaning. And so I attempt to, at least a few times a week, I get on my phone, on Zoom or on WhatsApp, and we do a little video chat and we connect. And that to me makes me a spiritually healthier person. There's some other ways. For example, in my life, without fault, my spouse will bring me a cup of coffee every morning. And connecting in that way, receiving that gift and saying good morning, that keeps our relationship in a way, and it's deeply meaningful. Those things we don't think of as being a part of our spiritual being, but they can become to us little rituals that are really enriching to the purpose and meaning of our lives. Not necessarily religious, but very meaningful. And it contributes to my spiritual health. So those are just some things, thinking outside the box. Again, I want to thank you for joining us with this Conversations for the Common Good. Tyler, thank you for leading us in this discovery of spirituality and religion. And I want to remind all of you listening that your chaplains at each of our facilities are available to you. You can contact them, talk to them about anything, and ask for tips on how you can become more spiritually healthy. Tyler, I want to invite you to say any closing words as well.
Again, just thrilled to be with you all. You all will notice that I'm going to be taking a break from our episodes. I actually am going to be leaving. I have to go to Officer Development School with the Navy in Newport, Rhode Island for 5 weeks. So Raquel will be joining with other mission leaders around the Texas Division in my absence. And I can't wait to see the wonderful things and wonderful conversations that you all have while I'm gone.
Wonderful. Well, we wish you well, Tyler, and thank you again for watching. We'll see you at the next episode.
Have a great day, everybody.